Today's video is regarding Dermovate, which is used to treat a wide variety of skin conditions where other corticosteroids have not been effective. In this video we will discuss what is Dermovate, its uses, how to use, conditions under which it should not be used, and its possible side effects. Dermovate contains clobetasol, which helps to reduce swelling, itching, redness, and scratching of the skin. It comes in cream and ointment forms. Cream is more suitable for moist, weeping areas of skin such as face, whereas ointment is more suitable for dry, scaly areas of skin or thick areas such as soles or palms. Dermovate is used to treat a number of conditions including atopic eczema, a condition that causes the skin to become itchy, dry and cracked. Psoriasis, where skin becomes scaly and inflamed. Allergic contact dermatitis, which is itchy rash caused by direct contact with a substance or an allergic reaction to it. Insect bites. Some people also use Dermovate for skin lightening purpose due to their potent bleaching action. But we don't recommend for skin lightening, as other better options are available in the market. Lichen planus, which is purple, itchy, flat bumps that develop over several weeks. Discoid lupus erythematosus, a chronic skin condition of sores with inflammation and scarring. Let's see how to use Dermovate. Wash your hand before applying the cream. Dermovate cream should be applied evenly and thinly to the affected areas of the skin, once or twice a day. Use for a period of 7 to 14 days. If condition doesn't improve, consult your doctor for re-evaluation of the treatment. Do not prolong treatment for more than 4 weeks. If necessary, continue treatment with less potent drug, such as hydrocortisone. Don't use Dermovate on broken skin or open wounds, viral skin infections, bacterial skin infections, acne, around the eyes or eyelids. The most common side effect of Dermovate are feeling of pain, itching, irritation, or burning in the affected area. If you have any question or suggestion, just drop below, we will answer that.